Okay, good morning and thank you for the opportunity. Now I'm going to share one of our research entitled Halal Certification Barrier in Small Medium Enterprise, particularly in Indonesian context. This is research from the team of School of Business and Management, Institute Teknologi Bandung. There will be four parts of my presentations from background, methodology, results, and also conclusion. Under the Act number 33, 2014, the Indonesian government released a new regulations that it is mandatory for all products distributed in Indonesia needs to fulfill the halal standard. And of course, if we see this from the market point of view, Muslim in Indonesia now it's becoming more demanding, not only in terms of fulfilling the Sharia law, but also in this COVID-19 pandemic, people are more concerned about health and also safety. And with these situations, with the new regulations and the COVID-19 pandemic issue right now, of course, logically, we expect that the number of halal certified products will increase. However, up to now, the percentage of halal certified products available in Indonesia is still quite low. So that's why this study wants to observe to show that several companies, particularly the small medium enterprise, are still hesitant to implement or adapt halal certifications, and attempts to highlight the gap that exists between the growing demand for halal food and the unwillingness of SMEs to obtain the halal certificate for their products. This slide shows the number of SMEs in Indonesia. From 2015 to 2019, it shows an increasing trend. So logically, we also expect that the certifications will be linearly increased, although that unfortunately, this is still becoming a challenging to us. Moreover, the existence of the SME itself will give positive contributions to gross domestic product, and also benefits to total workforce enabled to absorb, and also improving the investment in Indonesia. So that's why the halal certifications should be relevant with today's situation. So that to satisfy the demand for halal food products, the SMEs products needs to fulfill the halal standard. However, the challenge now is that the SMEs are facing several challenges associated not only with the regulations, but also their readiness to comply with the standard and also many other aspects. And the studies digging more, observe in a great details what kind of factors that becoming the barriers for SMEs to comply with the halal standard. So shortly, the objective of this study are to identify the barriers to halal certification for SMEs and, and identify the determinant factor that causes SMEs to be uncertified. The methodology that we use is by using mixed methods. In this case, we involve 58 owner of small medium enterprise, especially food, beverage, and also medicines in Bandung City. And we did a survey with the quantitative research methods to investigate what the barriers are that preventing SMEs from registering their product for halal certifications. And from that findings, we continue with the focus group discussions with 3 experts on June 2021 to verify and validate the barriers to halal certifications, and also the factors cluster. From the analysis, we found that there are in total 24 barriers that we find, and it is classified into three clusters, which are strategic factors, regulation factors, and also operational factors. The regulation factors is related with the mostly about awareness and understanding of the SMEs towards to the regulations, and especially the um, operational guidance related with the halal standard itself, while the strategic factors is related with the readiness of the players or small medium enterprise, starting from their leadership point of view towards to the halalness of the product, and then the mission, vision, and also the resources that they have towards to this halal standard, while operational is the tactical and activities on how that SME are willing to uh, following the halal standards into their business. And from our finding, we emphasize that SMEs should focus more on how their products can receive halal certifications. And also the government needs to help the SMEs by providing good knowledge socialization on how to certify their products. And for the conclusions, that this study has identified the barriers to halal certifications of SMEs food and beverage and also healthcare in Bandung. And the study also shows that most of the important factors were derived from the regulations and also strategic clusters. And SMEs should focus more on how their products can receive halal certifications, and the governments needs to help SMEs by providing a good socialization on how to certify their products. So that's all my presentations today. Thank you.